put down your pen. Because David, how do you
Yeah,
feel
I
about
kept taking
it?
it on the table. I saw that in the video, and I was like, I was like, "Gee, oh."
Yeah, put down your pen. All right.
We good?
Yeah.
Okay, perfect. So, in this debate, we'll be talking about healthcare. So, to start off my thesis and the affirmative side, the U.S. federal government should pass legislation to reduce healthcare expenditures. The legislation will be composed of guidelines on how hospitals must spend their resources, which includes time and money. These guidelines will be approved by the Department of Health and Human Services before putting it into the law. The government structure on health care is not adequate for most citizens and their insurance policies, as insurers can't provide enough coverage. The legislation is to focus on fixing the inefficiencies in the source of medical care. The hospitals and health physicians work to help Americans save money. My observation 1, with harms and significance. Inefficient hospital systems cause high healthcare expenditures and much loss in profit. Kaplan 2011. Accurate cost measurement in healthcare is challenging. First, because of the complexity of healthcare delivery itself. A patient's treatment involves many different types of resources, personnel, equipment, space, and supplies, each with different capabilities and costs. These resources are used in processes that start with the patient's first contact with the organization and continue through a set of clinical consultations, treatments, and administrative processes until the patient's care is completed. The path that the patient takes through the system depends on his or her medical condition. My next harm and significance, the American medical system wastes money and does not provide high-quality care for all. Lowry 2012. The American medical system squanders 30 cents for every dollar spent on healthcare. This adds up to an estimated $700 billion a year wasted while failing to deliver reliable, top-notch care. That is roughly equivalent to the annual cost of health coverage for 150 million workers, or the budget of the Defense Department, or the 2000 bank bailout. The Institute of Medicine's analysis of 2009 data shows $210 billion spent on unnecessary services like repeated tests and $130 billion spent on inefficiently delivered services like a scan performed in a hospital rather than an outpatient center. It also shows that the healthcare system wastes $75 billion a year on fraud, $55 billion on missed prevention opportunities, and $190 billion on paperwork and unnecessary administrative costs. My third harm and significance, the fee-for-service system pays for quantity rather than quality. Doctors and other providers are paid for each procedure they perform. The more services a patient receives, the more the patient providers can bill an insurance company or other programs. Under this traditional model, providers will make more money if their patients are sick. Healthcare costs in the country have soared due to this fee-for-service model. My observation 2 is the inherency. Obamacare is the first healthcare reform in years, and it limits the ability of individuals and private groups to make healthcare decisions. Our nation was founded under West 2012. Our nation was founded on the Declaration of Independence. Freedom of choice and a free market are at the core of our nation's soul. A governmental mandate for the behavior of individuals and private enterprises is an anthem to what our founders intended. The prospect of having an unelected panel of bureaucrats determining fundamental decisions about our individual health care is perhaps the most personal and intimate intrusion in our lives. The concept of this is absurd and dangerous laws. The concept of this is absurd, and dangerous law surely ranks with the grievances laid down 236 years ago. Beyond exerting oppressive control over individuals and private enterprises, Obamacare circumvents the foundation of our own legislative structure. My plan. The U.S. federal government should pass legislation to reduce the inefficiency in hospital settings. The legislation would focus on having a standard fund for each hospital so that they can use to make improvements in areas that lack efficiency. It will be directed towards health practitioners and changing their work style with more focus on the patient's need and their health in the past, present, and future hospital visits. This funding will come from the general federal revenue, and it will be enforced by the U.S. Department of Health and Human Services and hospitals across the U.S. My observation 3 is the solvency. Providers will be paid for quality and not quantity to reduce inefficiencies. To reduce spending and improve care, doctors can work in teams and share information. Make prices and costs transparent to consumers. Reward doctors for outcomes, not procedures. Ensuring all doctors use the best test practices and identifying and correcting errors among them. Healthcare providers can offer their own such smarter care. Examples such as to prevent rehospitalization, upgrading their record systems, and cutting out ineffective therapies. My next solvency is value-based medical organizations are key to success under Porter 2013. At its core is maximizing value for patients, that is achieving the best outcomes at the lowest cost. The U.S. must move away from a supply-driven healthcare system organized around what physicians do and toward a patient-centered system organized around what patients need. Focus must be shifted from the volume and profits of services provided, and switch to the patient's outcome achieved. And then my next one, patients will be able to pay less and save more under Rents 2015. For patients, depending on how their plans are structured, savings could potentially extend to their own wallets in the form of fewer or smaller co-payments. And this is the idea of paying for quality over quantity from the patient's perspective, which insurers favor as well. And my next LNC, patients will receive better treatment for the amount they are paying. If hospitals, doctors, and insurers could bring in a fraction of the money out that is lost, it would help to bend the so-called cost curve of runaway health inflation while improving patient outcomes. Americans should expect to get into demand to get better value for their healthcare dollar. And my observation for Advantage, the new legislation will promote preventive care. This shift towards preventive care is aimed at keeping patients out of hospitals and preventing the need for surgery, because those are where the big healthcare expenditures arrive. And my last one for Advantage, providers can reap the benefits of their hard work through bonuses. Through thoughtful policy, healthcare practitioners can be encouraged through rewards to focus more on what is best for the patients and less on the number of tests and procedures they can order. And that is it.
Okay, cross-examination. You have to stand up. Nope, you both have to stand up.
You both do?
Yes.
Okay.
Okay, face the camera.
Okay, just to clarify, can I get the qualification for the Kaplan 2011 source regarding inefficiency in hospital systems caused that caused increase in healthcare?
The source?
Right.
Yeah, Harvard Business Review.
Qualification for
Yeah.
Kaplan?
Yeah, Captain 2011.
Okay.
No, he's asking what's the qualification of Kaplan.
Oh, as just the author of the source.
Okay.
Face the camera.
And also, just to clarify, regarding the source that talked about the wasting money that the law in 2012, is there a particular reason why? I know it says that it doesn't provide high quality health care to some individuals. Is there a particular reason why that's so? You touched on that.
Wait, can you repeat that?
That source, you say it wastes money, it doesn't provide high quality care for
Oh,
individuals, right?
Yeah.
You just reiterate like that point that was made why like what's being wasted, or the money that's being wasted.
well, it's the American medical system in general. It's wasting over $700 billion a year.
Okay. Also with on the Rents 2015 source,
Mm-hmm.
you mentioned that more sources are being provided to individuals, but there seems to be a lack of quality for these services. I just can't make the correlation between couldn't you say quantity can be defined as quality as well?
With that source, what it's describing is, for the quality, it's how many, like, say, procedures a doctor's performing, and they make more money the more procedures they perform, and they're not, no matter if the quality was good or not, like, for the patients, in the patient's perspective. So, the harm in that is, they don't really, it doesn't matter if, like, procedures went well or not, they're still gonna get money.
Okay.
So, like, even if the patient isn't satisfied or something goes wrong, they're still getting paid for it.
Okay. Yeah, that's all I had.
Okay.
Okay. Do you want to take some prep time?
Yeah.
Okay. Are we doing flowing wise?
Pretty
Good?
good.
Good?
I don't think it's beat up yet.
Haven't been tested too much yet?
Exactly, yeah. This is gonna be the real test.
30 seconds used? One minute use? $130? Two minutes? So on case and off case. So on case is anything directly refuting the case, off case is any disadvantage or counterplan that Eduardo brings up.
Sorry. Okay. So, I want to first address that I'm going to be using the Affordable Care Act as pronounced as the ACA. I'm going to be using the ACA to stand for the Affordable Care Act. Well, my first point is that, well, with regarding with the ACA, it's actually proven to, I just want to reiterate that using Isidore, in 2015, he claimed, he wrote that a poll by Gallup found that the uninsured rate among U.S. adults declined to 11.9% in the first quarter, down 1 percentage point from the end of the last year and an improvement from the 18% without insurance in the fall of 2013, when the Americans were the first were able to sign up for coverage at state and federal exchanges. Just to reiterate the point that healthcare has proven to increase the number of people that have been insured, and has definitely gone down for the people who have not been uninsured. Also want to mention the point that with regarding Obamacare that limits decisions for individuals. Well, there's been some, from the ACA has proven to provide savings for individuals, as this is by Sullivan in 2015. A pilot program created under Obamacare to change Medicare's payment system saved almost $400 million and will be expanded, the administration announced Monday. An independent report released by the Department of Health and Human Services on Monday finds that the pilot program saved Medicare more than $384 million across 2012 and 2013. So there is some efficiency in some of the programs that are under Obamacare. Another resource to go off of this is that with Arden Ling in 2015, they stated that the creators of the new managed care system recognize that loss of fee-for-service financial incentives will lead to declining physicians' productivity. Thus, physicians working in these organizations are to be paid based on the RVUs, or relative value units. This number comes down to the value of clinical services provided. So fee-for-service is dominized for creating incentives to do more, but the new alternatives use the same incentives, saying that there's already systems in place, but the money that some of these services are receiving, they're being used to help with, again, providing services for some of the individuals who don't, who have trouble access to healthcare. With regards to the point with that, as mentioned, that a previous colleague said that regulation, by not having regulation, there's going to be a waste of money. Well, I say that there really isn't. That actually the money that's being spent on regulation, the time that's being spent on regulating some of these facilities is not being used on these patients, and that's what it comes out at the end of the day. As mentioned by Field in 2008, the array of regulations that govern healthcare can seem overwhelming to people who work in the industry. Almost every aspect of field is overseen by one regulatory body or another, and sometimes by several. Healthcare professionals may feel that they spend more time complying with rules and directed work than actually doing the work itself. Well, if you're claiming that these aren't efficient enough, regulating some of these facilities, well, some professionals are saying that they would rather use that time to work with their actual clients and the results of these services, because I mean that's the end of the day, was to help the people. Also, with regards to inefficiency in hospital systems, well, really that's kind of a minimal thing to this, to view at, and compared to the let's take a step back. You also mentioned that preventative care to clients, it saves money later on. Well, that might seem logical in one sense. I say otherwise with Newman in 2013 stated, it seems counterintuitive if you provide care to prevent all these expensive diseases. It should save money, but prevention itself costs money, and some preventative measures can be very expensive, especially if you give them a lot of people who won't benefit. Well, money's being, you're not really certain whether or not money's going to be saved. You're just saying, but not every preventative care service is money efficient, and there's some other services that prove otherwise. With regards to with the actual regulation on, if you increase regulation on some of these facilities and the efficiency of some of these hospitals and buildings and whatnot, Pope and said in 2013, said federal and state legislators have expanded public entitlements for care while restricting cost sharing and inhibiting market innovations that might constrain its costs, but threaten entrenched providers. Even before the full rollout of the ACA, government healthcare spending has soared from 3.5% of gross domestic product, $165 billion in 1987 to 8.4%, $1,250 billion. In other words, that increasing the regulation and the way these facilities are being managed increase the investment of these of the government's healthcare spending to the systems. I mean, that money can be used for other aspects. So if increasing regulation will cause the government to spend money.
Okay, cross-examination. Everybody has to stand up.
I have like 30 seconds, right? Go right into it.
You have to go right into
Go right into it? Okay.
And you both have to face the camera.
Okay. So. So you mentioned that the money being spent on, like, say, doing this regulation would not be used on patients.
Right.
Oh, what was that source from?
Wait, repeat that again.
The money being used, like, for regulation, it wouldn't be, like, used for the patients?
Right. Was the sources Field, he has a medical degree in 2008 in pharmacy and therapeutics.
Good. And you also mentioned, so your focus was on how the ACA is proven to give people more insurance, or just like help them get insurance, but I was confused on how that was relevant to this, since we're focused on inefficiencies in hospitals rather than talking about people with insurance.
Well, I'll turn it around and say that, well, if we're talking about facilities and regulation on these facilities, that itself is something minimal compared to the ACA, which is an actual service provided to these, to the Americans in the U.S.
Okay. And then